Go ahead.
Hey, good morning. I'm very glad Dr. Nissen, in his speech, he referenced our research. I'm very glad. Thank you very much. About keloid, what's the reason for a person to develop from an injury to a keloid? I think this is a very important question for a physician to give a good treatment. So beside I try my clinical practice these years, I aim to find out the reason about the development of keloid. With these years of study, I think we must change some of our opinions about keloid. Before, I only think that keloid is a local injury, local tumor. But with my study, I think maybe this is not right. So in this presentation, I will give all my research these years and my considering and my opinion about this disease. Okay? As Dr. Nissen pointed out, keloid pathological opinion in literature include these 4 points. One is oncologic theory. The other is genetic determinant, and then inflammation factors and immune disorder. With oncologic theory, then based on the opinion on the fact about increased keloid fibroblast proliferation and as phase of cell division, and third, high expression of signal transducer and activator of transcription 3 in keloid fibroblast. And the fact about genetic determinant is the report of keloid pedigree and report of keloid gene locus of some keloid pedigree. And about the theory of inflammation factors, they often refer to keloid often occur after injury and infection, and more inflammatory factors were reported, such as IL-1, 6, TNF alpha, and PDGF-BB, etc. And about immune disorder, high IgE, IgM, and IgG in keloid patient was reported, and more macrophage cell, for example, CD14 positive cell, and T cell such as CD3 and CD4 positive cell in keloid tissue than normal skin. What we focus on the following. One is keloid tumor immune microenvironment. Second, skin microbiome. And 3, gut microbiome. The following is our study result about keloid immune microenvironment, we found first, the proportion of macrophages were considerably elevated in keloid compared to normal tissue, while the proportion of CDC2 dendritic cells reduced. And the second is the ratio of M2 macrophage subpopulations was higher than M1 macrophage subpopulations in keloid. This is a result of our research. And CD8 positive effector T cells predominating in keloids, and the ratio of CD4 positive naive T cells and proliferating T cells were decreased in keloid compared with adjacent normal skin tissue. And also, there were more CD8 positive and CD8 positive cells and fewer CD4 positive cells in the keloid compared to surrounding normal tissues. About skin microbiome, as referred by Dr. Nissen, we found there were bacterial composition difference between the keloid and the normal skin. At the species level, Clostridia, etc., were abundant in keloid, while Desalto, Vibronocea, etc., were abundant in control normal skin. Second, microbiome diversity were also different between keloid and control normal skin groups. And the samples of control normal skin group exhibit higher diversity than that of keloid samples. And Clostridia, etc., increased in keloid. We use fish analysis and find positive bacterium staining in dermis layer of keloid and control, and it should the more bacteria exist in control normal skin, and electron microscope results verified that there were bacteria in the cytoplasm of keloid fibroblast cells. We also studied gut microbiome in keloid patients and found Bifidobacterium adolescentes were more abundant in keloid patients, while Streptococcus pyosanguinis and other bacterium were more enriched in health population. We use microbiota transplantation to demonstrate if microbiome change can influence the development of scar. We use rabbit model and find changed microscopic scar thickness before and after fecal microbiota transplantation. and gut microbiome change can cause metabolic profiles. When focal GC-DCA was more abundant in healthy population, and then TC-DCA in blood were significantly increased in healthy population, and hydrocortisone were enriched in keloid patient. And we think there may be a gut metabolite and scar axis. Based on this study, we think there will be some gut microbiome disorder in keloid patient. And because of this gut microbiome disorder, skin immune disorder was caused. And then this caused skin microbiome disorder. So when an injury was occur and skin inflammation reactor will be disordered, and then wound fibrillation repair disorder can also occur, and then keloid formed. So this all I think about keloid development, all about the reason which can develop from an injury, from an inflammation to a keloid. Maybe there are some facts we should research in the future, but I think this opinion can help us to prevent the keloid disease occur in our treatment procedure, and tell the patient to pay more attention to a healthy life. I think this is what I have done, the mean of our research. Thank you very much.